Your feet might be warning you about diabetes. Are you paying attention? Strange sensations, unexpected colors, and other silent signs could mean diabetes is creeping up on you. Today, we're revealing 12 surprising foot warnings you need to know and simple ways to protect your feet and prevent serious damage. Stay with me. You won't want to miss this. Let's dive in. 1. Numbness or tingling in your feet. Numbness or tingling in your feet might seem harmless, but it could actually be a major warning sign of diabetes. Imagine feeling like your feet are falling asleep, except it's happening even when you're wide awake. It's not just from sitting in a weird position or being on your feet all day. When high blood sugar starts to damage your nerves, especially in your feet, it's called diabetic neuropathy. Think of your nerves as tiny wires sending signals throughout your body. Now imagine those wires getting frayed and worn out because of high blood sugar. That's exactly what's happening here. This nerve damage can cause a range of unsettling sensations, from tingling and burning to complete numbness. And here's the scary part. If you can't feel your feet properly, you might not notice a blister, cut, or sore, which can quickly turn into a serious infection. Diabetic neuropathy doesn't just cause discomfort, it can set you up for dangerous complications. So, if you're noticing these sensations, pay attention. How often is it happening? How intense is it? Keeping track of these symptoms and bringing them up with your doctor could be a crucial step in catching diabetes early and preventing further damage. 2. Swelling in the feet or ankles. Swelling in your feet or ankles might seem like a minor annoyance, but it can be a serious warning sign of diabetes. Think about it. Have you ever looked down and noticed your feet looking puffy, almost like they're filled with water? It's easy to blame it on standing too long or wearing tight shoes, but this kind of swelling could be your body trying to tell you something. When blood sugar levels stay high, they can damage blood vessels, especially the tiny capillaries in your feet. These capillaries are like tiny pipes that help circulate blood and fluids. But when they're weakened, fluid can start leaking into surrounding tissues, causing that swollen, heavy feeling. It's like a sponge that's soaked up too much water and can't squeeze it out. Over time, this trapped fluid can put pressure on your blood vessels, increasing the risk of blood clots. A dangerous complication for people with diabetes. And it's not just about discomfort. Persistent swelling can also lead to skin infections or sores that heal slowly, setting the stage for more severe complications. So, if you notice your feet or ankles swelling up regularly, especially if it's paired with pain or a feeling of heaviness, don't brush it off. Keep track of when it happens and talk to your doctor. It could be an early warning that your blood sugar needs serious attention. 3. Dry and cracked skin. Dry, cracked skin on your feet might seem like no big deal, but it could actually be a glaring warning sign of diabetes. Imagine looking down and seeing your skin flaking, peeling, or even cracking so badly that it feels like it's splitting open. It's easy to blame cold weather or just dry air, but high blood sugar can be the real culprit here. When blood sugar levels rise, your body loses water more quickly, leaving your skin dehydrated. And it's not just about losing moisture. Diabetes can also damage the autonomic nerves that control sweat glands. Without enough sweat to keep your skin naturally lubricated, it becomes rough, tight, and more likely to crack. And those cracks aren't just uncomfortable. They're like open doors for bacteria and fungi to sneak in, turning a simple dry patch into a serious infection risk. Think about it. A tiny crack in the skin might not seem like much, but if your blood circulation is already compromised, that small opening can quickly turn into a breeding ground for infections that take forever to heal. So, if you notice your feet looking unusually dry or starting to crack, don't just slather on lotion and forget about it. Keep a close eye on those areas, moisturize daily, and talk to your doctor to get your blood sugar checked. Your feet could be warning you about a bigger problem. 4. Non-healing sores. Non-healing sores on your feet might seem like a small issue, but they can be a loud, flashing warning sign of diabetes. Imagine a tiny scratch or blister that just refuses to heal, lingering for weeks or even months. This isn't just slow healing. It's your body struggling to repair itself because high blood sugar has weakened your immune system and damaged your blood vessels. Think of your blood vessels as delivery trucks carrying vital nutrients and oxygen to every part of your body. But when those trucks are broken down or blocked, even the smallest wound can turn into a major problem. Without proper blood flow, your body can't send enough nutrients and oxygen to the injured area, leaving it vulnerable to infection. And for people with diabetes, that's a serious risk. These slow-healing sores can quickly become open doors for bacteria, setting the stage for severe infections, tissue damage, and even gangrene. If left untreated, what started as a tiny cut can spiral into something much worse, potentially leading to amputation. That's why it's crucial to inspect your feet daily. Pay attention to any cuts, blisters, or wounds that aren't healing properly. Don't ignore them or assume they'll get better on their own. Catching these signs early can make a huge difference in preventing serious complications down the road. 5. Cold feet. Let's move on to sign number 5. Cold feet. Have you ever noticed that your feet feel ice cold, even when the weather isn't chilly, or you're indoors where it's warm? This isn't just about bad circulation or wearing thin socks. If your feet are constantly freezing, it could be a red flag. Prolonged high blood sugar can cause serious damage to your circulatory system, which is responsible for pumping blood throughout your body. When your blood vessels get damaged, it becomes harder for blood to reach your feet. This means less blood flow, which leads to less warmth and oxygen in your feet, leaving them feeling cold. On top of that, nerve damage caused by diabetic neuropathy can make it even worse. It's like having a heater in your home that suddenly stops working. No matter how much you try to warm up, it's not going to help. If you're experiencing cold feet, along with numbness or changes in skin color, this is a serious sign and should never be ignored. It's a warning that something is off, and it's time to talk to your doctor. Getting early intervention can make a huge difference in preventing further complications. So, if your feet feel cold for no reason and don't warm up, don't hesitate to seek help right away. 6th, skin discoloration. Let's talk about sign number 6, skin discoloration. Have you ever looked at your feet and noticed strange patches? Maybe they're turning darker, paler, or even showing odd red hues. It might seem like a cosmetic issue at first, but trust me, it's more than just that. This is a warning from your body that something's wrong. When blood sugar stays high for a long time, it affects your blood circulation. Your blood doesn't flow properly to your feet, and because of this, some areas of your skin can turn dark or red, while other parts may become pale or ashen. These color changes happen because the tissues in those areas aren't getting enough oxygen and nutrients. Over time, chronic inflammation or even necrosis, tissue death, can cause dark spots or bruises that just won't heal. If you notice any discoloration like this, don't ignore it. It's a clear sign that something needs attention. Get those changes checked out right away, because early action can make all the difference in keeping your feet healthy and avoiding more serious complications down the road. If you found this information helpful, don't forget to subscribe for more health tips and wellness insights. 7. Thick, deformed, or fungal-infected toenails. Now let's dive into sign number 7. Thick, deformed, or fungal-infected toenails. Have you noticed your toenails getting thick, rough, or turning yellow or brown? This isn't just a sign of aging. High blood sugar can actually weaken your immune system, making your toenails a perfect spot for fungal infections to take root. When your blood sugar is high for a prolonged period, it also damages circulation, meaning your toenail tissues aren't getting enough oxygen or nutrients. This poor circulation can cause your toenails to become brittle, discolored, or grow unevenly. The result? Painful, infected nails, and if left untreated, things could get much worse, even leading to cellulitis, a serious skin infection. If you notice these changes, don't wait for it to get worse. Make sure to keep your nails clean and trimmed regularly and watch out for signs of infection. The good news? You can prevent a lot of these issues by taking care of your feet early on. Don't let something as simple as toenail care go unchecked. It could save you from a lot of trouble down the line. 8. Hair loss on toes or lower legs. Sign number 8 is hair loss on your toes or lower legs. Have you noticed the hair on your toes or shins thinning or even disappearing? It's easy to think it's just part of getting older, but it could be a warning sign of something more serious. When blood sugar stays high for a long time, it can damage your circulation. This means your small blood vessels, especially those around your toes and lower legs, aren't delivering enough blood to important areas like hair follicles. Think of it like a plant without water. Without the necessary nutrients and oxygen, hair can't grow. Plus, high blood sugar can also lead to nerve damage, which further weakens the hair follicles and stops them from regenerating. This type of hair loss can be a sign of broader problems with your blood vessels and nerves, so don't ignore it. If you're noticing thinning or bald spots on your toes or lower legs, it's time to get it checked out. Taking care of your blood sugar levels can make a huge difference in keeping your circulation and your hair healthy. 9. Painless blisters or vesicles. Sign number 9 is painless blisters or vesicles. If you notice blisters or fluid-filled vesicles on your feet that don't hurt, don't let that fool you into thinking it's nothing serious. Diabetes can cause nerve damage, and one of the side effects is a dulled pain sensation. This means you might not feel when something's wrong with your skin, like when a blister forms. Even though these blisters don't hurt, they can still be dangerous. If left untreated, they can become entry points for bacteria, leading to infections that can be hard to treat. Plus, high blood sugar weakens your skin's natural protective barrier, making it more vulnerable to irritation from things like tight shoes or rough surfaces. So, if you spot these blisters, don't pop them. Keep them clean and make sure to see a doctor to prevent any complications. It's always better to be safe and get the right care as soon as possible. 10. Recurring infections. Sign number 10 is recurring infections. If you find yourself dealing with repeated infections on your feet with no obvious reason, it's time to pay close attention. High blood sugar weakens your immune system, making it harder for your body to fight off bacteria and fungi. Your feet, being covered in shoes and constantly exposed to friction and moisture, are particularly vulnerable. This creates the perfect environment for infections to take hold and thrive. On top of that, poor circulation from diabetes means that your body has a harder time delivering the nutrients needed for healing. This is why infections such as toenail fungus, skin infections, or even cellulitis can become stubborn and return again and again. If you notice an infection that won't go away or keeps coming back, don't wait. Treat it quickly and stay on top of it to avoid bigger problems down the road. It's important to keep an eye on your feet and get medical attention if infections become a recurring issue. Your feet are talking to you. Listen closely and take action. 11th, unusual pain while walking. Sign number 11 is unusual pain while walking. If you experience sharp pain, cramping, or a heavy feeling in your feet while walking, and there's no obvious reason like an injury or bad shoes, this is a warning sign you shouldn't ignore. High blood sugar over time damages the blood vessels and nerves in your body, leading to a condition called peripheral artery disease. Essentially, your blood flow is restricted, which means less oxygen is getting to your foot muscles and tissues. As a result, you may feel pain, discomfort, or heaviness, especially when walking or standing for extended periods. But that's not all. Nerve damage caused by diabetes can also send false pain signals to your brain, even when you're at rest. This can make it difficult to tell if the pain is real or just a result of nerve damage, which is why it's so important to take these symptoms seriously. If left untreated, this pain can disrupt your everyday life and cause further complications such as decreased mobility. The pain you're feeling could be a signal that your circulation and nerve function are compromised, so it's crucial to consult with a doctor to find the right treatment. Don't let it go unnoticed. Pay attention to your feet and seek medical advice as soon as possible. 12th, changes in foot shape. Sign number 12, changes in foot shape. If you notice that your feet are swelling, developing unusual arches, or forming bumps that weren't there before, it's not just a sign of aging or normal wear and tear. This could be a serious warning related to diabetes. High blood sugar levels over time can lead to damage in both your nerves and blood vessels. This damage weakens the muscles and bones in your feet, making them more prone to deformities. One example is Charcot foot, a condition where bones in the foot can fracture or even dislocate, causing the foot to change shape dramatically. The loss of sensation from nerve damage often means you won't feel the pressure or pain that would normally alert you to injury, allowing things like calluses, sores, and even necrosis to develop without you noticing. These changes can severely affect your ability to move and may lead to permanent damage if not treated in time. If you notice any changes in the shape of your feet, it's critical to take action quickly. Early intervention can help prevent further complications and protect your mobility in the future. Make sure to check your feet regularly and consult with your doctor if you notice any unusual changes. Protecting your feet is key to your overall health. Check them daily for any signs of swelling, redness, or cuts. Keep them clean, moisturized, and wear comfortable shoes to avoid injury. Most importantly, control your blood sugar by eating well, staying active, and visiting your doctor regularly. If you notice anything unusual, don't wait. See a healthcare provider right away. Your feet can reveal so much about your health. We've covered 12 important signs, from numbness to changes in foot shape, all of which could be early warnings of diabetes. Start paying attention to your feet daily. Your health depends on it. Don't forget to like, subscribe, and share your foot care tips in the comments. Thanks for watching, and I'll see you in the next video. Thank you for watching our video today. If you found this video helpful, please drop a like and subscribe button to support us. We truly appreciate you support, and it will motivate us to continue make more information video to help you all. Thank you, and goodbye.